Good afternoon. Hi, Jeremy. How are you doing today?
I'm doing well, thank you. It's really nice to talk to you today.
It's very nice to talk to you. So before we start saying why we're having this interview, let's introduce ourselves. So my name is Laura Maria Caldarone. With us, we have Jeremy Rossman, all the way from Chicago. I'm in Germany, and we are here because it's actually all about Jeremy. It's the introduction of this new series that we are doing called The Long Haul, and it's a series about long COVID. We are in the second year of the pandemic, and one of the most important things that there is in this pandemic is long COVID, because everything, in my opinion, revolves around it, right? The more you know, the more you understand that you don't want to get COVID, because we know why, because it can get really bad regardless of how old you are or if you have or don't have pre-existing conditions. But there's also the fact that whether you have a mild course or something a little bit, you get a little bit more sick, you can have long COVID. So we're dedicating this series to long COVID, the human touch of it. So getting to know the stories of the patients, their journeys, and the journey of their loved ones, because it affects not only the person that has long COVID, but everybody around them. And we are going to have a splash of science. So we will have episodes that are dedicated to the science of long COVID, how it's going with research and so on. And that's why we have Jeremy with us. He's the one that's going to be doing these episodes. So I think before we talk about the science episodes themselves, let's talk about you. Tell us more about yourself, aside from the fact that you're in Chicago and you're a scientist.
Thank you. Yeah, I'm a virologist, which means that I have been studying viruses and how they interact with the body and how they interact with our immune systems for about 20 years now. And that has really changed over the years and is dramatically different right now than it has been, 2 years ago, 3 years ago. So I used to spend a lot of time in the lab looking at viruses, trying to pick little pieces apart and trying to understand how they work, and importantly, how we can disrupt that so that we can actually help people get better, we can stop virus transmission. But recently, I've started a nonprofit organization that is trying to facilitate this sort of communication of science and scientific research to communities. And so this is where I'm coming from looking at the pandemic right now, is trying to bridge that gap between community action and scientific research. And long COVID is a community. This is a community of long COVID patients. And what I'm trying to do is trying to help bridge that research and trying to bring that scientific expertise. And that's where I'm going from these series, is really to try and say, what do we know? What don't we know? Which is unfortunately much more than what we do know. But try to convey that in a way that helps the patients, helps spur more research, helps spur more advocacy, and really importantly, helps really bring awareness to the idea that, COVID is not a mild illness. We talk about the fatalities, and that's incredibly severe and incredibly important and a real tragedy. But there's also a huge number of patients with long-term symptoms from COVID. And as a virologist, I think this is, um, shocking, because we have the tools to stop virus transmission. We have the tools. We know what to do. And we respond to infectious disease outbreaks around the world all the time. But we're not acting strong enough. And so we're getting continuous cases. We have 131 million cases of COVID around the world. And if even 5% of those cases go on to long-term symptoms, that's 6.5 million cases of long COVID. I mean, that's incredible and so tragic. So I'm trying to raise awareness to support the community, to support action, to support research, and to do whatever I can to bring that science to the community.
To the community, because as you mentioned before, the pandemic, before this pandemic, you were already working as a virologist. You were already working with viruses, and you knew how bad a virus could be and what it could do and so on. And knowing that, having that knowledge, and then seeing how the last year, took place, and the beginning of this year, yes, it is true, we have vaccines, and they're extraordinary vaccines that you can say whatever you want to say about vaccines, but the fact that within a year of a new virus going around, scientists from all around the world were able to put aside their work, were able to get together and just work together with one goal, using all the technology and the knowledge they have amassed for decades. It's amazing.
Absolutely incredible.
It's incredible. So it must be, I can imagine it must be all like so interesting for you, for a virologist, for scientists to live through this pandemic, right? Interesting, but also maybe even harder than people, than others, right? Just like you mentioned, because we have the tools, and you're like, but I know what we have to do. We know what we have to do, what is happening, right? So this is why you are doing the series, because just like me, we thankfully, knocking on wood, we haven't had long COVID. But what I guess put us in the same boat is the fact that we understand how important long COVID is, and we understand that everything and anything that is possible needs to be done in order to not get COVID, right? Because that's how you get long COVID. And who knows? We don't know how long COVID is, right? It could be decades, it could be years, but even months.
Mm-hmm.
It's not something that we want. Tell me a little bit more about the beginning of the pandemic. Were you in Chicago the whole time? I just want to understand, like, as a virologist, when was the moment that you felt, I don't know, like a gasp, and you thought, uh-oh, this is going to get bad?
Yeah, I mean, it's been a weird year and a really traumatic year, or more than a year now, for everybody. But it was a really surreal experience watching this happen, as a virologist, because, I was hearing reports from Wuhan in China in December about these new cases of a respiratory disease, and starting to hear, this trickle. Okay, there's this new disease, we don't know what it is. And then you start to hear a little bit more and say, well, actually there are more cases of it, which is concerning. We get new diseases. I mean, this happens, but sometimes we figure out, okay, it actually is a disease we knew all along, or sometimes it is a new disease but it doesn't spread very well. So we're always just sort of watching what happens. Is this an animal disease that just jumped into humans and then stops, or what happens? And so I kept watching these little reports and saying more and more, and then there seemed to be evidence of this possible human to human spread. And once you started to hear that idea that, okay, maybe the disease is actually spreading from person to person, then I started to get a little bit worried. But this happens. I mean, we have infectious disease outbreaks. We have new viruses, we have new diseases, but what happens next is the critical thing. And so we then had that big outbreak that stemmed from the seafood market that we've all heard a lot about. And that wasn't where the disease came from, but that was the big outbreak that really seemed to start the disease spreading. So I just kept listening, hearing more, and then we saw more and more cases around Wuhan. And it was concerning. It was definitely concerning, but there was this perception that that disease would probably stay in China. And even if it spread a little bit further, it would probably only spread to neighboring countries because we didn't know at the time how transmissible it was. And then we heard, okay, it's a new form of SARS. And people said, okay, well, that's good. We know a little bit more about the virus. That's really helpful. But SARS was an incredibly severe disease, but it was a disease that had, people were most contagious when they had the worst symptoms. So there was a real good sign as to who was infected so that you could quarantine, so that you could treat. And the disease stayed predominantly around Asia. And so people said, okay, this is probably going to be like another SARS. So let's respond strong. And a lot of countries around Asia really did respond strong because they had that experience.
They knew what could happen if they didn't.
Exactly. They went through this once before.
Yeah.
So, and that really helped them. But the point that I started to get really concerned, I was concerned because this is an infectious disease outbreak. This is a severe disease. People are dying from it. But, sitting in Chicago and, talking to people and people are saying, should I be concerned? And I was saying, we should be alert and we should be aware, but you don't need to be concerned here at that time. And then I started to see cases in Europe. And then we saw spread in Italy. And then we started to see spread from there. And that was the point in time in which I said, right, this is no longer going to be contained in China and a couple neighboring countries. This is now already worldwide. And that was really scary. But even at that time, nobody really understood how transmissible the virus was. And so I was still saying at that time, I was saying, look, this is concerning and we really need to be monitoring. But I wasn't telling people to worry. I wasn't telling people to go out and wear masks or do this. And so it was a continuous process from there. And this is the thing is, science isn't static. Yeah. What we know about a disease changes over time. And so, you can't look at, what I said last March, I would probably look back and say, oh, I should have been recommending, much more precautions. I should have been, recommending different things, but we just didn't really understand. And there's still much we don't understand, but we're learning much more.
And also there's the fact that, at least the way I see it, no matter how globalized we are, in the end, it's a lot about each country protecting themselves, right? Knowing what they're okay and not okay with others knowing or not knowing. And so from let's say an American perspective, there were many things that were not clear yet that needed to be double checked because it's normal, right? You want to see yourself how anything is, not necessarily a disease or this pandemic. And then you have, because Italy already around the 20th, 22nd of February were sounding the alarms, and was saying, this is getting really bad. Hey, world, listen to us. And here in Europe, you would have neighboring countries. You would have Spain and France, and you have the UK. It's not going to happen to us. It's going to stay in Italy. And then how? It's already here. And also the fact, like you said, hindsight, right? 2020, like what can it be? Because I have a very big imagination, so maybe that's why. And I have worked in the infectious disease sector a little bit. So when China started building the hospitals, and when they locked down 23rd or so of January, Wuhan, millions of people and everything. And then when I saw in that John Hopkins map, which was a black map of the world with little dots of red around, mostly in China. But when I saw those dots outside of China, I was like, we're going to do something. The United States is going to do something. Europe is going to do something. We got to do something. And I feel like, obviously, yes, we could have done more, but then again, we can always do more, right? If you look back at the past, no? And that's why I think knowing all these, seeing all the missed opportunities, let's say, from different countries, right? So even South America, when Europe was doing poorly, I know for a fact, because I'm half South American, they were saying, no, that's not going to come here. So from Asia went to Europe, and then South America looking and saying, don't worry. And that's why long COVID, with all these missed opportunities that we've seen, that we've had, we need to know and need to realize that the more cases, right, the more COVID cases, the more long COVID we will have. Talk to me a little bit about the United States. What's the situation with long COVID there? Because there's different studies that have different percentages, right? Of cases that were COVID, how many of them become long COVID? What's the story in the US?
Yeah, so I mean, this is the U.S. is an interesting story because even sort of going back to what you were just mentioning a minute ago, this idea that you know every country is responding differently and what that means for the country. And yeah, I can look back with hindsight and say, okay, this is what we should have done, but I can also look now and say this is what we should be doing and aren't doing. And that's a problem too, is that we're not learning as well from what's happened as I feel like we could be. And that's really frustrating because in the US we have 31 million cases of COVID right now. It's an incredible amount of COVID. I mean, cumulatively have had 31 million cases of COVID. And it's a tremendous amount. And there are still states right now that are saying, okay, you don't need to wear masks and you can open up. And so right now in the US, we've had cases going down for a while and then sort of plateauing at a relatively low level. We could get them lower, but a relatively low level. But the issue is that then that creates that idea of saying, okay, well, we've kept cases low, so now we can start reopening again. And then you start reopening and then cases go up. And so you just get the cycle of cases going up and cases going down. But at the same time, each of those cases, there's a risk that the patients are going to die. It's people are having severe diseases, a real hospital burden. But then there is a percentage of people of those 31 million in the US that then go on to have persistent symptoms. And so we're also really not taking the steps to make sure that we're preventing those long-term symptoms. And there is more research, there's more funding, there's more awareness, at least in the US, on long COVID and why it's important and trying to understand what it actually is. But this is a small level and this is really early. And how many cases of long COVID? I would love to be able to answer that question. It's a critical question, and we just don't know. I mean, we know that it starts off high, and that for a large number of people, it sort of goes down over time, so that maybe a month after you have acute symptoms, you're going to have a higher percentage of people that have persistent symptoms for a month, and then that's a slightly lower percentage at 2 months and slightly lower at 4 months. But then you have maybe 5%. It's hard to really quantify, but a significant percentage of people that have symptoms for a year, and we just don't know where that's going. We don't know how many people that is. We don't even really know how to look for it, because this is all dependent on patients reporting these long-term symptoms.
Yeah.
So I don't know. I really don't know.
It's difficult because at least the latest studies that I had seen, the percentage range is anywhere from 5-10% to even 30%. So there's been information from Europe, from Russia, even from the States, and so on. And the fact that it has nothing to do, I mean, probably some to do, but we don't know yet. There's not enough information, because you have children that have it, you have young people that have it. So, 20, 16-year-olds, 16, 20, 30, 40, 50 that have it, but you also have the 70, 80-year-old that has it. And you have people that were marathon runners and, they were as healthy as health can be, and they have it. So, and it's women and men. So it's really difficult, because you can't even say, okay, if you are in this and this and this and this category, then be more careful. Everybody else do as you please. First of all, because everybody is interconnected, right? So I might be extremely healthy, but the people I live with, someone might not be. So what do? Do I move to another house? Do I stop contact with them? Because that's the problem, right? With a virus, you transmit. There's the whole host thing. And that's one of the mistakes that we have seen throughout the pandemic since the very beginning, of not using precautions, right? So not thinking, oh, this is a novel virus. I don't know what it is, what it's going to do, how long or anything. It's better if I'm careful, right? Like, the devil you don't know is worse than the devil you do know, right? Because who knows how bad it can be. And this is the same with long COVID.
Yeah, I mean, this is sort of my frame of mind when I'm viewing this, is that, this is really a strong case for taking more precautions, and for erring on the side of more caution than less caution. And it's like, there's that perception that COVID is a mild disease, that for the majority of people, it's a mild disease. And I think partly this stems from early on in the pandemic, because we were really worried about, all the fatalities from COVID. And we still are. I mean, this is, still, there are a lot of people that are dying from COVID. This is not a mild disease. But there was this sort of learning who's susceptible to COVID, who's susceptible to severe COVID and having respiratory distress. And, who are the patients that are dying from COVID? And that sort of early research was looking and saying, okay, actually it's the elderly and people with a lot of underlying health conditions. And so, which is true, those are the groups of people that are at the highest risk of dying from COVID. But first of all, people of any age and any health have died from COVID. It's not that that's the only thing, and if you're young and healthy, you're safe.
Yeah.
But that it changed that sort of narrative and that perspective to say, well, yeah, actually, so young, healthy people, are just going to have a mild case. And kids are, barely going to have any symptoms whatsoever. And that's not universally true, but a lot of people do have very mild cases. But then we're seeing that even if you had a mild case,
Then you have long COVID.
a month later, 2 months later, exactly, you can start to have symptoms. And you can have symptoms that are so much worse than what you had when you had that actual COVID infection. And so this can, like you said, this can happen to kids, this can happen to elderly, this can happen to marathon runners. Like, maybe there are factors that, predispose people. We don't know what they are. So, this is a huge risk to your health, to my health. And this is one of the reasons why I have taken such strong precautions in my own daily life to make sure that I don't get COVID. And thankfully, so far, that's worked. But it's because I'm just saying it. Like, I would much rather take these precautions than have the risk of dying from COVID,
Yeah.
let alone the risk of long-term disability.
Yeah. That's exactly how I see it, because I know for a fact that people that are healthier and younger than me have had long COVID or have had COVID and died.
Right.
So if younger and healthier than me can have it and have long-term effects or die from it, I don't want to gamble with that. I just don't, And also the other fact is, when we heard this from the beginning, right, which was one of the biggest curses that we've had in this pandemic, this mentality from the beginning of thinking, okay, but it's people with pre-existing conditions. So what you were saying, right, people with pre-existing condition or the elderly, because first of all, everybody has someone they love that is elderly.
Yeah.
Why wasn't that, thought of or communicated in that way? Because it wasn't. Even now, like, you still hear people that are like, it's fine, I don't care, it's only the elderly or the old, as they say. But what is old? Like, where is that line? Because I am older than other people, so am I considered old? And
Right.
also the fact, pre-existing conditions, there are more people with health issues and pre-existing conditions than there are people that don't have them. So 30-year-old with pre-existing condition, is that considered sick and old? So, right?
Yeah.
It's
And it's true. And even with, like you said, like even with, if you're like, I'm not elderly, or I don't live with somebody that has pre-existing conditions, we're all connected.
Yeah.
And viruses spread from person to person.
Yeah.
So, even if your immediate environment didn't have somebody in high risk, it's that chain of transmission that leads to the community and leads to people at risk. But of course, now we know that when you factor in long COVID, everybody's at risk.
Everybody's at risk. And as you said, another curse of this pandemic is the fact that, unlike the SARS that we were more familiar with from our past, where you knew that someone, was transmissible and had it and it was bad because of their symptoms, the problem here is that you have people that their nose is not even running. They don't even have fever or throat ache or anything, but they have the disease. And whether they'll get symptoms or not, at that moment, they are transmitting it. So they are giving it to other people. And that's why it's been so difficult. And it is so difficult. And that's why so many people are less cautious and are thinking, but I'm fine. Because in the end, it's not visible, right? You can't see a virus. You can with all your tools in your lab, but here you can't. So what do you do? So it's a lot of like trust and believing, right? And history and knowledge and science and
You're absolutely right, because that is that sort of fact that you can transmit the virus without having any symptoms. And that doesn't mean that you won't get symptoms, but we know that the virus spreads best the day before and the day of you getting symptoms. And so, that makes it incredibly difficult, because it does rely on exactly what you said, on trust. Because you can't have that mentality of saying, well, I don't feel sick, so, I'm okay. Because with other diseases, we talk about this with flu, we talk about this with SARS, if you're feeling symptoms, okay, you should go get tested, or you shouldn't go out, or things like that. But if you don't have symptoms, you don't have any indicator that you might be infectious. And so then it's that trusting and taking action despite not seeing that evidence yourself. And so it's reliant on trust in what science is saying, trust in what the government is advising. And so often it's been, it's something that it's so hard to watch, but there's not a lot of trust. And some of that has stemmed from, governmental policies. Some have stemmed from poor scientific communication. Some of that has stemmed from media and misinformation. But often there's not that trust. And so, you are asking people to really sacrifice and put all of these actions into play in their lives that are really difficult and really hard on a lot of people. And you're asking them to trust that is for not only their good, their neighbors' good, their family's good, their community's good, but to trust that and to act based on that trust, and to act based on that sort of idea of precaution, that a little bit of precaution is so much better than the outcome of not taking that precaution. And it's a really difficult thing, and something that I think we've really struggled with in a lot of countries over the course of the pandemic.
In too many countries, because again, going back to this whole globalization mentality, in many ways we are globalized, which is one of the reasons the virus has spread so fast and easily, right? We travel by plane so often and so much more than my parents did in the 80s and 90s, for instance, 70s or whatever. So there is that part, but at the same time there's this thing still of like my little bubble, which is great if you use it in the sense that it improves your bubble inside and what is around it. But if you don't learn from others, because Asia had so much knowledge already mid-January, end of January, beginning of February, the science community, a big part of it, already had knowledge from 2003, 2009, from the 70s, from like all the different like epidemics and pandemics and Ebola and this and that. So a lot of the things that are that we need to do, right? As you were saying with the transmission and everything, they're not new things. They're not things that just were created in 2020 or were created for COVID-19 or for the coronavirus pandemic. No, it's knowledge and history and science and technology and common sense and logic put together. And that's what we have, right?
Yeah, I mean, that is the core. It's that learning from experience and discovering more as we go. But that combination of past experience, what we're currently understanding, and common sense, and just a little bit of precaution combined together makes for a very effective sort of mentality that can drive strategy. But there's been so much of saying that okay, like you said, that it won't happen here, and it can't happen here. But then also, a lot of countries have had pandemic preparedness plans, because we had a flu pandemic in 2009. We've had pandemics in the past. We'll have pandemics again in the future. But it was thought that the most likely pandemic was going to be a flu pandemic. And so there was also that idea of saying, okay, well, we've planned based on the past, but we planned for something specific. And then we got something totally different. And it took a really long time to sort of pivot and adapt and say, okay, yeah, what we're experiencing right now is not the flu, and we need to respond differently. So there's a real need for that sort of adaptation and willingness to say, we were wrong. And as a scientist, I can say that, a lot of what we thought, a year ago is wrong. But it was based on the evidence at the time. And so that evidence is continually evolving and refining. What I would say if we had this interview next year is going to be very different. That doesn't mean that, I'm giving you bad advice or telling you things that are incorrect. It's just that we are going to learn so much more, and we are all the time. What we need to make sure we're doing is taking that on board and adapting based on what we're learning, what we're seeing, and not be so rigid and fixed in a plan and an idea of how we think things should work.
And if you want to be really rigid and fixed on something, then we should all be rigid and fixed on the fact that it is true that, well, obviously this year plus has been all about the coronavirus pandemic, but there is a reason. It is because it's a novel virus. It's because it's a pandemic. And if you don't deal with it, everything, absolutely everything that is going wrong in your life will get worse. There's no way it can get better. If you let more cases, if you let more infectious, like transmissions going around that lead to more cases, that lead to more hospitalizations, that lead to more deaths, that lead to more long COVID, and hospitals saying, oh yeah, you had your cancer checkup, sorry, you'll have to come back when things are better. Or yeah, you wanted to get your plastic surgery, yeah, not a good time, sorry. Or school trips or anything. There's no way that anything can get better if you just let it go through us, right? Because sometimes, I speak to my grandmother. She's over 90, and it's been very difficult for her. She is in a small town in Sicily, and she has barely seen anybody since last March. So it's over a year. And she, reminisces and tells me, like, even the war wasn't like this, because there were breaks, right? There were moments during the day, during the week, during that year, during that period, that you were okay. So you could be with other people, There were moments, of course, that you heard something's going to come, something's going to happen, and you were more careful. But here's like, you have to be constantly careful, right?
Yes.
And this is difficult. Of course it is difficult. It's stressful. It's annoying. It's sad.
Yeah.
It's maddening also, because as we were mentioning before, there are mistakes that are repeated. There are missed opportunities that just keep on saying, hi, you're missing me, next. And because it's country to country, right? Since it's a global health emergency, what you're seeing now in Brazil, for instance, which unfortunately we know it's beyond tragedy right now, it's basically the future telling us, hey, if you don't wake up, you're going to be Brazil in Europe. You're going to be Brazil in Africa. You're going to maybe even be Brazil in the United States. But again, you have so many countries, even in Europe right now. There are flights from Sao Paulo every single day that get here in Europe, where the staff does not quarantine. They don't even get tested. Maybe the passengers get tested. They eat on board, so masks are off. We know that, yes, airlines have done a lot of things and even tests, but we know that, the test is like a snapshot of the situation in your body in that moment, right? But there's so many things that are not being done. And yes, there's the fact that people say, that's too late. You should have closed the borders and done something about it before. Yes and no, right? Because one thing I keep on thinking is, like, I always think, if I leave my bathtub water, the tap on, right? And it's floating my bathroom and my house and everything, I can start drying everything, but if I don't close it, I'm not going to win.
Right. Yeah. I agree. And it's like, you could say, okay, well, we mopped up the water on the floor, and so, we're okay right now. But then it's just still going. So there is that sort of, there, I mean, there are a lot of things that a lot of countries have done right. There's a lot of good examples here too. And there's a lot of things that we're seeing sort of even right now of really, practices that are, really dangerous. And the issue that I keep seeing is that the fact that we seem to be, and again, this is not true for every country and every area, but in a lot of areas we're responding to what we're seeing in a really small like space of time. We're saying like, look, this is what's been going on for the past month, and we're looking ahead like 1 month and seeing, okay, so this is what we can do. This is what is, okay in terms of the virus, and this is what, we need to do in terms of prevention. But, the virus is that, the bathtub is still full. And so, we need to be looking further ahead. We really need to be saying, okay, so how are we actually going to drain that water? Instead of just saying, what are we doing right now with the little bit that's spilled? And so, that is where sort of long COVID, I feel like really, really comes into play, is because we're talking about not only sort of what is the exit strategy, what is the strategy for more than the next couple weeks in, how our country is going to do that so that we can actually start to, live differently than we've done over this, past over longer than a year. And, part of that is just saying, well, look, even once, if let's say in 2 months, we manage to completely stop virus transmission across the world, end the pandemic. It's not going to happen. I'm not saying that it's going to happen, but like hypothetically, even if we did, there's a large perception that that's the end point, that stopping virus transmission is the end point. And it's a really important point. Don't get me wrong. This is one of the most critical things that we can be looking at right now. But what happens then? You mentioned people that were already having problems have been hit even harder by the pandemic, and communities that have been disadvantaged, that have been suffering from systemic inequities, have been suffering the worst under COVID. So how are you going to help those communities rebuild? And then what happens to the patients with long COVID? Because, once the pandemic's over, once the virus stops transmitting, if we ever get to that point,
What do you do?
We're still going to have millions of people with long COVID. And how are we going to support them? What is their life going to be like? And what can we do to help that? And what can we do right now to start helping to ensure that there are fewer long COVID patients in the future, and that those long COVID patients into the future are supported, are treated, are, understood, are listened to, and can actually be able to hopefully have a treatment.
Exactly, because it's so much. That is true. The pandemic, the topic itself, and everything that is connected, it's complicated, right? That's why, for instance, when you have the stay-at-home orders, and sometimes you have people that get annoyed at other people, right? Or mad and say, but how complicated is it for you to just stay at home, please? And I guess it depends, right? It depends who you're talking to. If you're talking to somebody that is able to do home office, that their employer allows them to do home office, that they have a spacious enough living reality, then yes, why are you not staying home? But if you're talking about people that you have 5, 10, because you do have places, again, inequalities, where you have 5, 10 people that are in a 2-room apartment, let's say, where it's not a yearly contract or 10-year contract or even 6-month contract that whoever is working has, but they gotta go outside and work, and whatever they make that day is the food that's gonna be on the table that night. And if you don't think how these policies affect them, if a government, because in the end it's the government, like a lot of it has to do with the government that a country has, because it is them that people pay taxes to, it is them that have, like a chunk of money that should go to emergencies. It is them that need to be able to help the people that need more help, because some people need less, thankfully, but we have too many people, like you said, inequalities, that when you say just stay at home, you think, oh, but that's easy. My job allows me to, thankfully, but that's me. That is not the reality of too many people, even in a developed country, even in a European country. So we don't have to think South America. We don't have to think Africa. We can even say the United States. You have areas in the US where they hear the policies, they hear what the lockdown is going to be like. And even if they wanted to be part of this community thinking of, I help you, so you help me, how, if they don't have any help?
Yeah. Yeah. It's a critical aspect because, there is so much inequality, and, this is, it's really difficult because, so, okay, I'm very fortunate in that I could work from home, that I can do a lot of this work from home, but not everybody can do that. So how do you help and support the people that can't do that, that can't, if somebody gets infected with COVID and they have a large family that's all living together, how do you support them? How do you, there are so many really difficult aspects here that is not just, and this is why it's not just sort of like you know a hand waving, a broad perspective of here's the gold standard of what we should do, because we have to really take into context people's situations, because not everybody can do that, and we have to be able to not only help protect people from the virus but also support people. And I mean, I'm seeing that, I see this in Chicago all the time, and an example is what we're seeing right now in the vaccine rollout. So vaccine rollout in the US has dramatic inequities in vaccine distribution to more wealthy communities versus more disadvantaged low-income communities. And it's very frustrating because those communities that are suffering from these systemic inequities, that have been disadvantaged for a very long time, are the ones that have been hit hardest with COVID, that have essential workers that do have to go into work every day to support their families, and they are the ones that need the vaccine most. And yet often they have significantly lower rates of vaccine distribution than we're seeing in wealthier areas that can stay home.
I can
and
stay home.
It's a big problem.
Yeah. Yeah. And like with the example that you gave of Chicago, it's not like one area of the world, it's not one country, it's every country has their little areas that need more help, just need more. And again, going back to long COVID, like you said, if in 2 months transmission is completely over globally, what about the people that live a more difficult reality, that they are in one of these places that it's more inequality than anything else that you see, and they have long COVID, who takes care of their loved one? Who takes care of putting food on the table of their children or anything? So yes, less COVID means less long COVID, but what do you do about the long COVID that you already have?
And that is, well, that's actually part of what I hope this whole video and interview series is about, talking about sort of, at least from that sort of science side is, so what do we do? Because yes, there's that really strong case, and I really like how you said it. It's just, the fewer cases of COVID we have, the fewer cases of long COVID we will have. It's as simple as that. So the more we stop the virus transmission, the better off we'll be in terms of preventing long COVID. That's really simple. But then, so how are we supporting patients? How are we understanding the disease? How are we learning about how to treat it? But it's really important, we're talking about these inequities, and it's really important that we're looking at that internationally, and that it's not just sort of wealthy areas by a US teaching hospital that are the only people that can get long COVID support. So what about countries that aren't even recognizing long COVID as a disease right now? And what about areas even in the US where patients have long COVID, but they can't get to the large teaching hospital that has the one long COVID clinic? So how do you make that support broad within the country? How do you make that support to be able to impact the lives of everybody with long COVID, whether that's in a disadvantaged community, whether that's in a wealthy community, whether that's in the US, the UK, or in Brazil? How do you make sure that you are supporting and trying to understand the situations of everybody globally with long COVID?
And also, I mean, I know for a fact that you pay attention to not only what happens in your country, obviously, but what happens globally and in Europe. And as you well know, in the last months in Europe, yes, maybe in the last week or so, because things are getting really bad again, things have backtracked a bit. But for the last months or so, you've had different countries just loosening the restrictions, which obviously that is a goal. That is what you want. You don't want, I don't want to be in lockdown. Who wants to be in lockdown? I live in Germany and we've been in lockdown since November.
Right.
If you ask me how serious of a lockdown, not serious enough, I'll tell you. And then you ask me, but wait, you don't want a lockdown? Of course I don't. But if we're having a lockdown, it's because many of the epidemic control measures that need to be in place, that need to be up and running, they are not, for whatever reason. And so you need a lockdown because we need to put those numbers, transmission, down. And then you ease up, right? But here, there's been easing up because people are tired. That's the problem, right? People are emotionally, physically just tired, sad, annoyed, and they're like, okay, whatever. Let's see how it goes. And we see how it goes. And obviously, it goes worse. But one of the biggest problems is the fact from the beginning of the pandemic, the economy was very important for many countries, for many governments, which obviously the economy is important. Everybody likes money, everybody needs money, everybody wants money, me included. But is money more important? No, not when you can save my life, your loved one's life, and not when by opening the economy, then you're forgetting and ignoring a lot of things that just get bigger and bigger and bigger problems. Because right now, losing those restrictions in the last weeks and months because of the economy, because we need to consume, has led to stricter lockdowns, has led to more infections, to more people hospitalized, to more people dying and to more things being worse.
So I keep hearing all this, and it's there's so much emphasis on wanting sort of the one answer, wanting the one thing. Okay, we need to protect health, or we need to protect the economy, or we need to do a lockdown, or we need vaccines. And there's been this focus on saying, I want that one thing that I can just commit to that will then make it all better. And the issue is that it doesn't work like that. You can't separate economics from health. Economics affects health, health affects economics. You can't separate the two. You need to protect both. And likewise, lockdowns can be useful, but lockdowns are not going to solve the pandemic by themselves. There are, as a virologist, as somebody that works on infectious diseases, I know there's a whole range of things that you can do and that you need to do, and that they all work together. And that's what I always find so frustrating, is to see, lockdowns that then ease, but without all of the other infrastructure and without all the other protections in place, with really good testing, with contact tracing, with, really good public communication. And so this comes back to what we talked about before, is trust. So, if I am being told in Chicago that, tomorrow I need to have a hard lockdown again. Well, okay, so maybe, but why would I trust that? Why would I trust that that's going to be any different from what I've seen over and over and over the past years? I want to see that sort of integrated strategy. I want to see something that is saying, right, we're getting good vaccine rollout, and that's great. But let's support that with really good testing. Yeah. Let's support that with really good communication. And also, let's support that at a community level by understanding, what's going on, what people are going through, what's happening in that area, instead of saying, look, this is the broad thing we need to do, and this is going to be the one thing that's going to solve it all, because that hasn't worked. And so, just like we've been talking before, it's a matter of adapting and learning, but we really need to be looking at people. And this is ultimately, whether we're talking about COVID, whether we're talking about long COVID, it doesn't matter. It's all about people. Yeah. And it's so easy to focus on policies and big changes and big things, but what's happening to people? How is this affecting them? How can we support them? How can we help keep them safe? And safe economically, safe physically, safe mentally. All of this is important. It all needs to work together.
Yeah. Because after all, going back to long COVID, because this is a series about long COVID, it needs to be in the minds of the decision makers. It needs to be in the minds of the policymakers, of the people that are part of the pandemic response of any country. Long COVID needs to be there, because how can you loosen restrictions? How can you say everything's fine when reality says otherwise, without thinking, yes, people die of this disease and it is awful and we don't want that. But one of the big things is, it's not get sick and live or get sick and die. It's not you recover or you don't. You may recover for a little bit, but then you can have long COVID. So easing restrictions, you are ignoring long COVID. That's what you're doing. Because if the community transmission is high, if there's so many cases and new variants, and there's not enough testing, and contact tracing, like you were saying, is not good enough, and people are not being supported with good communication or with money or with answers or any help, then you are basically saying long COVID, which is a problem that you are going to have to deal with as a government, as a country, because you're adding that category, right? That's what you're doing. What do you do?
Yeah. Yeah, exactly. And it's again, this is one of my hopes with this whole series, is that idea of awareness and real sort of awareness, but sort of then hopefully coupled with action. And like, yes, at a political and policy level decision of saying, okay, look, we're acknowledging that this is happening. We're acknowledging that the more cases we have, the more cases we'll have of long COVID, and that will continue into the future. And so, we need to be accounting for that in what we're doing right now in the middle of the pandemic. But there's also that need for awareness at all levels. I mean, there's a need for awareness of people that get COVID, that this is a possibility, and that so that if you have these long-term symptoms, you don't start wondering, like, what is happening to me?
Yeah.
People need to know that this is a possibility, both in terms of preventative action, but also for maybe reassurance isn't quite the right word, but knowing
You're not
that
alone.
yeah, what is going on, that this is something that we're learning about and that can happen. But then at a medical level, you know people need to know that, like, if they go in to their doctor with symptoms of long COVID, that the doctor is going to recognize that,
Yeah.
that they're going to work with them, that they're going to try and get support and care. And that at a research level, we're saying, yeah, we need to dedicate resources to this. We need to dedicate effort, time, attention, money. We need to come up with something that we can use for these patients. So it's all levels, but it's awareness that hopefully is coupled with action.
Yeah. And like you said, that's the goal, right? With your work, with the series, with everything, the goal is that there's recognition, there's awareness, that there's studies, that there's help for those that have it, and to prevent. But the reality right now, like we spoke about earlier, there are many countries that they don't even take long COVID into consideration. Long COVID is not even a thing in their language. And then you have countries and places around the world where, yes, long COVID is becoming something that more serious and people are talking about it. But again, it depends where in the country. So where, in what town, in what city, because you may be unfortunate that you have long COVID, you don't understand what's happening, you go to your doctor and your doctor is not up to date, or your doctor unfortunately does not believe it, because you have that in this world, not only with long COVID and COVID, but you have had instances where doctors do not believe the patients. And with the series, that's what we're trying to do. So from your perspective, so this flash of science, where you're going to be talking to different scientists from around the world on everything that we discuss from a science perspective. So where we've been, where we are, and where we're going with long COVID. And then you will have episodes that are more of the human factor of how has their journey been like for the patient, and how have they been supported by the loved ones, and how difficult it has been for them, because that's another problem of this pandemic, right? We spoke earlier how difficult it is to be aware of something that is invisible, right? Such as a virus or this virus. And it's the same situation with long COVID, because since anybody can get it, young and older and healthy or less healthy, you, as someone that doesn't have long COVID, you can't relate. You're like, okay, but I don't get it. Are you telling me that you're exhausted? Or are you telling me that before you could run and now you can barely take 5 steps? Or are you telling me you have heart problems, but how can that be? But everybody in the world can relate to loving someone that is not doing well, loving someone that has a a condition, has a disease, has a illness. And that's what we're doing with the series, right? It's the long haul. So from a scientific perspective of getting that awareness, getting that recognition, getting that help. And from a storytelling perspective, understanding that if this is happening to you, you're not alone. And if you have someone that you love that this is happening to, listen to these stories, right?
Exactly. I really like this combination because, hopefully we can have that science supporting, because this is about the patients. This is about their families. This is about their experience. And, hopefully that the splash of science is that sort of enrichment and that sort of perspective on what we know and where we're going that helps sort of frame things a little bit. But it's about the patients. It's about the people that are suffering from long COVID and what that means and what that spurs onto for the future.
I'm very excited about this new series. I'm very excited that we'll be doing it together, you with the scientists, me with the patients and the loved ones. And it will be good. It's going to do what it needs to do, right? Tell a story that you see it, understand it, feel it, and realize that you need to work towards not telling that story, towards not being one of the people that tells that story, right? Because that's you don't want that, but you need to hear what the people that have it, right? You need to hear from them.
Exactly, and that is what I think about all the time, is that sort of awareness of what people are going through and that sort of call to action to help and to support, but also that sort of internalized saying of, yeah, I really don't want to go through that myself. I can see, I hear the stories, and I want to make sure that that doesn't happen to me. I want to make sure that that doesn't happen to other people. And then I want to support the people that are going through that.
Yeah. It's the cautionary tale, right? That's what it is. I'm really looking forward to it. We've spoken so much about everything, and if I could grab a cup of coffee, I could continue even without coffee, just talk and talk, because it's an unfortunate reality, this pandemic, but it's very interesting because there's so much to it, and it's very different from one country to another, right? And from one experience to another. So, but I think we've covered pretty much everything that we wanted to cover as an episode that introduces the series, as an episode that explains what you will be doing with your splash of science and how you and I are connected to this series and what each of us brings. So I think, unless there is something else you want to add, I would only have one more question.
Okay, go for it.
My question is, what message? It's a two-part question. So the first part is, what message would you give to the people that are going to be watching this series? So the patients of the long COVID patients, but as well as the people that love someone that has long COVID.
Yeah. So to the patients and the family, my message is that you're not alone. There are a lot of people out here that are learning and advocating and trying to support and build awareness and build action to support you. You are not alone.
No, it's true, and it's needed. No. And the second part is more about you. Just what do you hope? Like, I know there are scientists that like to do predictions, and there are scientists that don't, just like, there's people that like and that don't like. And if it's possible, I'd like to know, what do you hope? What is it that you hope that will happen in the next few months from a worldwide perspective, in the United States, also long COVID, obviously. And since there cannot only be good things, there are unfortunately bad things, I'd like to also know fears. What do you fear?
So I'll start with my fears to end on a more positive note. But my fears are that countries will continue to sort of take half measures, and that we will continue to have this cyclical nature of cases rising and cases falling, and we will have this sort of half life that we've had for a very long time, while we have continued cases in the emergency room, where we have continued fatalities and more cases of long COVID. Now, I think that's tempered by the fact that in a lot of areas, there are good developments. And so that sort of leads me to, the hopeful side, which is that, as we're getting more areas that are having better vaccine coverage, we have great vaccines right now, and that's shockingly wonderful news. So as we're starting to get more vaccine coverage, if we can be supporting that with all the other public health measures, still wearing masks, still taking precautions, still, testing and contact tracing, together,
And
that can be
ventilating.
incredibly potent. Yeah. And we're starting to see, some countries, Israel has extremely good vaccine rollout, and they've seen cases go way down, they've seen hospitalizations go way down, and so we can be doing that, we can support that with other measures, and that gives me a little bit of optimism that over the coming months in a lot of countries we will start to see that improvement in cases. And I do worry, because I think that's going to take a lot longer in a lot of countries, because we don't have equitable vaccine distribution in many countries, let alone worldwide. And then with the vaccines needed to be supported by other public health measures, I do, worry how long that's going to take in a lot of countries. But I do hope that we're going to start to see these improvements, that we're going to start seeing cases go down in ways that we can actually have a little bit more of life going on, a little bit more protection at the same time. And that I also have this hope that, through things like long COVID SOS and body politic and these videos that we're putting together, that we can be raising more awareness of long COVID, so that as cases go down and as countries start to recover, we don't forget about the long COVID patients, and that we start now, as we have, dedicating the time and the resources and the effort to understand it, to support patients, so that as cases go down, our support of long COVID patients goes up, and that we can really try to facilitate recovery and not just resolution.
I think that says it exactly what we hope, what we aspire with this series, with our talks. And I hope your hopes do come true. And I do have similar fears, but I'm optimistic. I'm still optimistic. I'm a little bit of mixed pessimist, optimist, but I think after a while, what can you do, right? You got to be realistic and optimistic, because if you're pessimistic and realistic, that's really ugly, especially in a pandemic. Yeah. So let's be optimistic and realistic, and let's do as much as we can to improve, because after all, improving the situation is good for everybody, including yourself. So
exactly.
Thank you very much, Jeremy. It has been a pleasure. I think we have, like I said, pretty much said everything that we wanted and needed to say. And I am looking forward to the series, and let's see where we go from here.
Sounds great. It was my pleasure too, and I'm really looking forward to hearing the patient stories, hearing the family stories, to talking to the scientists and the doctors and the researchers. So I'm really looking forward to putting this together with you.
Same. So have a good day and then a good evening, and we see each other soon.
Thank you, and you too.